As you walk through the new Springfield Regional Medical Center, it should be readily apparent about the wide use of green technology and energy-efficient modalities throughout the campus. One of the most prominent and visible features of our commitment to energy efficiency and green technology is the green roof. We have, at the time the hospital was built, the largest green roof in the state of Ohio. We were very successful in identifying a number of what I would describe as back office services and activities that traditionally had been located within the hospital, in the new hospital, are now located elsewhere. And this has proved to be a very excellent opportunity for us to demonstrate great stewardship, because it's a much more efficient use of the new hospital campus by really keeping the majority of services, programs, and activities on the new campus to be directly related to the provision of patient care. We were successful in working with local city authorities to allow for city bus routes to literally go through our new campus. This affords a higher level of accessibility to those folks in the community that are challenged in their transportation needs and having access to the hospital. So now we have the opportunity to have bus stops literally in the front of the main entrance of the hospital.
Outside Lourdes OR number 2, we had a stage 2 sterilizer that was basically out of support from the manufacturer. This sterilizer, the electronic sections went out and we could not repair the unit. So this basically had to be placed into the budget for replacement. At one of our off-site facilities, the Lourdes Medical Pavilion, they had a stage 3 sterilizer in use, and the internal vessel of this sterilizer burst, basically rendering this unit unusable or unrepairable. What we did was we researched the availability of taking the electronic section from the Lourdes Medical Pavilion, installing it on the electronic section of the stage 2 sterilizer outside of OR number 2. Basically, what happened is we were able to convert the stage 2 sterilizer outside surgery OR number 2 to a stage 3 sterilizer by utilizing the electronics from the Lourdes Medical Pavilion. We basically was able to give the organization 2 new sterilizers for the price of one.
We bought a second room of endoscopy equipment for our gastro guys. When we did that, the doctors wanted a high definition monitor. We got the quotes and everything from Olympus, and their monitors were way high. I work with a second vendor here on other things, and he came in and said, hey, I can get you a high definition monitor for less than half that price. And so we bought one, put it in, let the doctor see it. Ended up buying 2, and still under what they would have, because we have 2 endo rooms. We bought 2. We bought the one in the first endo room, the initial room, and they loved it. So then we bought the second one, put it in the second endo room. It's increased our endo room time because now they're finding colon polyps that they never could see before. So the quality was every bit as good as what Olympus would have given us, only we saved a lot of cash for that.
Since I started in January, I have been talking to administration and different folks about malnutrition coding and how we could possibly do a better job here at Mercy Health for better outcomes with our patients.
One of my first things that I wanted to do was to see if we could increase our capture rate with malnutrition. And what I was able to do is I researched the national average for malnutrition and found that it was 20%. After running some reports and some numbers here at Mercy, I realized that we were only being able to capture about 2 to 3%. And capturing means we want the physicians to compliantly document malnutrition in their medical records. And doing this helps the hospital system increase their CMI, increases the length of stay for patients. It also affects the acuity and the severity of illness. It affects nursing care. Caring for people that have malnutrition takes a little bit more time and compassion and So I was able to get a hold of John, who is the manager of dietary, and together we pulled in our team, my CDS leads at the site, along with his leads, and we were able to come up with an action plan.
The dietitians were a key component, and we met with over 20 of them throughout the system to talk to them about how important they were in this process to recognize this with patients. The beauty of this was when we met with them and talked, they already were well aware that a lot of our patients were coming in malnourished, and even though it was going to be obvious in short order that it was going to take a little more time and effort on their part, they couldn't have been more excited about being part of this new process procedure that would give us better outcomes with the patients.
And then we educated the nursing staff, the wound care nurses, the physicians, and educating everybody has been able to have a positive impact on our documentation, our capturing of the malnutrition, and we've actually been able to increase that rate to about 10 to 12% across the region. So we've seen a lot of success with this, and I'm hoping to concentrate on some more numbers and see what next we can do as a good sign of stewardship. It's been great working with John and his team, and I can't wait to branch out and work with somebody else.